Hello, my name is Dr. Harrison. I am the obstetrician gynecologist today. So, a little background about me. I opened my clinic about 6 years ago after my husband and I decided that we wanted to start a family. We were not aware that I was the carrier for having issues for reproducing kids. I know that based off my previous medical history, I did have fibroids, but we never assumed that that would be a factor for me having any issues. So oftentimes families come into my clinic and they're trying to start a family. They come in under the perception that the mother is the issue for the baby not being able to be conceived. So I will do an examination on both mother and father. Starting with the mother, I'll just ask her general questions about her menstrual cycle, her medical history, her family's menstrual cycle, just to see if there are any factors that can contribute to her having any issues during her conception. So we test for things like dysmenorrhea, like are you having painful periods? We test for nostalgia, breast pain. Every now and then a woman will assume that her leukorrhea is overbearing, but I ensure that as long as there's no odor, it's normal. You just have your body's just cleansing itself. Sometimes women do exhibit dysmenorrhea. So I do tell them, like, change your diet, work out regularly, and you should see a change in your cycle. Every now and then a woman will come in because she thinks she's having amenorrhea. However, she is just exhibiting early menopause, and depending on genetic factors that can contribute to it, and that's pretty much it. However, on the men's side, a lot of men aren't aware that it is so important to get annual physicals. I always emphasize the importance of getting a physical from ages 12 to 30 during those hormonal years when men are typically starting to try to reproduce. Oftentimes men have oligospermia, but they are not aware that their sperm count is low. I do remember a couple years back I had a patient come in and he and his wife were trying to conceive a child. However, he was not regularly getting checked prior to them starting their relationship. So he, in fact, had gonorrhea, and he started to exhibit ballinorrhea, a discharge from his penis. He wasn't aware that the discharge wasn't normal because it only happened during ejaculation. So because of that illness that was not cured properly, he was the factor for why they couldn't have children. So we then tested him. We found out that he had azoospermia, so his sperm count was just not there, but we did go ahead and move forward with a procedure where we removed the blockage that was causing his sperm not to come through successfully. And from there, they have had an amazing journey starting their family. So I always emphasize specialists to sit down, talk to their patients, find out background history, previous relationships, genetic history, test for genetic mutations. Don't always focus on the woman. Also look into the man and his history because it can make such a difference. So from there, I have been really successful in my journey, and I wish you all the best when it comes to you and your practices and your patients. Thank you.